Marilyn Wilson. I am the supervisor of public health science for the programs for the elimination of cancer disparities at Washington University in Siteman Cancer Center. Welcome, welcome, welcome to our annual Smart Health, actually 2020 and 2021 Smart Health Community Education Day event. We're so happy to host this event because we had to cancel last year, and this is one of our signature events. So let me tell you a little bit, just a little snippet about Smart Health. Smart Health was created to provide our community partners with deeper learning opportunities pertaining to cancer prevention and research, to use as a platform to report back on research results and to educate individuals and families about research and its relevance. So Smart Health has been around for quite some time, since I say about 2013, and we're still going strong even in this climate. So we're going to start off, since we asked our audience and participants to hold off on any questions, but please feel free to put your questions. You can do that now in the chat, so we can start some of the questions if you like. But I do have a few sample questions to start off with that will kind of get the conversation going. Let's just pretty much talk about the signs and symptoms of breast cancer. Dr. Glover-Collins, you want to take that?
As far as signs and symptoms of breast cancer, we all know about the bump, that the infamous lump that some people feel, which leads to a breast cancer diagnosis. But the people at Know Your Lemons have done a beautiful job of illustrating to us some of the other signs and symptoms that we should look out for when determining if we need to get a deeper look into the breast to figure out if we have breast cancer. So, get my highlighter going. So of course there's the bump, the outward lump, but sometimes it's something that you don't see on the outside, but you feel it deep inside the breast, okay? But we don't want to ignore the skin changes as well, such as dimpling of the skin. You might notice that your nipple has started pulling in. You might notice some hot or warmth to the breast and some redness or changes to the color of your breast. Maybe your breast is starting to look like an orange peel, or you just notice that the pores of your breast have become more prominent. So there's a change in the texture of your breast. Sometimes cancer presents as sores on the breast, or that there's an actual change in the shape of your breast. The biggest thing that you should see here is that I don't have anything talking about pain. Pain is often a late symptom of breast cancer. So we don't want to ignore these other signs and symptoms. I also neglected to show this one about new fluid coming from your nipple. This can be bloody fluid, or this can be clear fluid. And this should be something that's coming on its own. You might notice it as a wetness or a stain in your bra or your shirt, and it's coming pretty frequently. All of these are signs and symptoms of breast cancer that deserve to be worked up further. And then the last one, which is how I like to detect it, is that hidden lump deep in the breast that we can't feel, that we see on the screening mammogram, because the screening mammogram shows us the earliest stage of breast cancer where we can easily treat it. So once we have a diagnosis of breast cancer, we often want to know what the stage is. The stage helps us to figure out as physicians what kind of treatments we need to give, but also it helps me to figure out what's your chances of beating this disease and being alive 5 years from now. So the earliest stage of breast cancer that we have is stage 0, okay? And that's the DCIS, or ductal carcinoma in situ. So here you see that the breast is made up of milk glands and milk ducts leading out to the nipple. And when you have cancer cells that have started filling up the milk duct but haven't broken out yet, that is the earliest stage of breast cancer. This has a 99 to 100% cure rate with surgery, and is the earliest stage of disease that we have. Then you have your stage 1 cancer, which also has a very high cure rate. Greater than 97% of the time we can cure you and you're alive and doing well without disease years down the road. And these are usually your small cancers. They haven't spread to the lymph nodes yet. Or you might have a few little clusters of cancer cells in the lymph nodes without an actual mass in the breast. Stage 2 disease, actually they break it down into A, B, and C, and rather than break it down into this, I'll just kind of tell you. With stage 2, that's when we start having cancer to leave the breast and go to the lymph nodes. And so you have multiple lymph nodes showing frank disease or cancer. Or you might have a small tumor with some lymph node disease, or then your tumors get a little bit bigger, more than the 2 centimeters, but less than 5 centimeters. In general, the further that cancer travels from the breast, the later stage you may be, and the prognosis or the chances of beating this becomes a little bit worse. For stage 3 cancer, you have the larger diseases, 5 centimeters in the breast, but then sometimes beyond the lymph nodes in the armpit, we might start seeing cancer traveling towards the lymph nodes around the collarbone or in towards the center of the chest. Whenever cancer starts eroding out of the skin, and now you're having these ulcers, these wounds that just don't seem to heal and they're bleeding, or you have the cancer growing back towards your chest wall, invading that muscle, that's why you start getting those pains that just don't seem to go away. Those are your later stages of breast cancer, and survival tends to be in the 60% or less range. And then finally, once breast cancer leaves the breast completely in the lymph node region, let's see here, sorry, you have the stage 4. And the places that breast cancer primarily likes to spread to are your lungs, your liver right here, the bones of the skeleton, and your brain. Symptoms of breast cancer in these regions are many. They could be where you're not breathing as well, you're finding it difficult to go upstairs without having to stop and rest for long periods of time, or you might notice that your eyes are becoming yellow. You might notice that you're having problems that similar to a stroke, where you're having problems with headaches that don't go away. These are all signs that cancer could be outside of the breast and have traveled to these places. Once you reach stage 4, it's not considered to be a curable disease, but it doesn't mean an automatic death sentence. One of the great things about science is that we've come a long way in treating metastatic breast cancer, and people are living years with metastatic breast cancer and living a comfortable life. So don't always think that stage 4 is I'm dying in 6 months and let me sell off all my worldly possessions, because we have treatments. We just means that the road, it might be a little bit more tough. Oftentimes we have patients that have a strong family history of breast cancer in the family. And so what we tend to think about for that is the genes, the BRCA genes 1 and 2, or sometimes you might hear it as the BRCA genes. And what that is an abnormal gene. If you have it, it can increase your risk of developing cancers. The most commonly known is breast cancer, but there are some other cancers associated with the BRCA gene. A positive gene testing helps doctors to screen you appropriately, because just because you have a high risk, that means we want to catch it early. So you might need to get mammograms and MRIs more frequently than someone who doesn't have these genes. Positive gene testing also helps you to know your risk. As you can see over here, if you have a BRCA mutation, your risk of developing breast cancer is 50 to 80%, as opposed to someone else who doesn't have it, whose risk of developing breast cancer is only 12%. Ovarian cancer is also very high with the BRCA1 gene and the BRCA2. So knowing your risk helps you to better determine what types of things you can do to also decrease your risk. Sometimes that means removing your breast prophylactically or without ever having a cancer diagnosis. But then, that's not the end of the world. And that's not the path that everyone chooses to take. There are medications that are available to help decrease risk as well. And so that's where having a breast surgeon or a knowledgeable physician to help you do screening and risk reduction is important. And I've said screening at least 10 times in my presentation, so I guess I should go over the guidelines. Different physicians prescribe to different guidelines. The American Cancer Society and the United States Preventative Task Force has come out with guidelines saying that you should start screening mammogram at the age of 50 and should stop at the age of 74. And you should have a mammogram every 2 years as opposed to every year. However, the American College of Radiologists and most breast surgeons start screening at the age of 40 or 45, depending on your risk. And we usually go until we expect you to have less than 10 years of life in you. Okay, so if you're 90 years old and you're still doing great, you might still need to have mammograms. And we recommend that you get the mammograms every year, just so that it helps you to stay on track, because then you know whether or not you've had your mammogram for the year and you don't have to remember whether it was 2 years ago or 3 years ago, so that we don't let things pass before and get out of hand.
Diagnosed. So a little bit about my story. I was originally diagnosed in 2014 with stage 2 breast cancer, and that had spread to my lymph nodes. And my journey with stage 2, I went through the surgery. I opted for a lumpectomy. I had chemotherapy, radiation, and I had no history of breast cancer in my family that I knew of at the time, no history of breast cancer. And I thought I was the healthiest person. And then one day, actually, ironically, Valentine's Day in 2014, I went to get a mammogram, and that's where it all began. My life was changed instantaneously. I had no idea the challenges that were before me, because really when you're thrust into cancer, no one tells you. It's just like, okay, we have to treat it. Okay, this is advanced. And so your world is just, it's a whirlwind. And so when I think about it now, I really didn't have a chance to really process it, but something beautiful came out of it, because I started an organization, Hats for Hearts. And that was birthed out of me having my first chemotherapy treatment. When I entered the room, the infusion room. So we have this large room, and we're just all patients in this room. And I thought, wow, we're all in here about to get treatment. Like, there's no privacy. So, nurses were saying, asking other folks, have you been depressed? What medications are you on? And I was like, wow, this is something. So in this room, though, it was just a dark place, because we were all battling this thing. It was an unknown. And the only thing I have to say, for me, I was so nervous about losing my hair. Okay, this is so bad. That was one of the side effects that, I was like, oh, losing my hair. My family was so supportive. Folks start cutting their hair off, in support of me, because I kept saying, oh, I'm gonna lose my hair. Not even talking about the battle that was before me. I was just so like, oh, my hair. So I started this amazing organization, Hats for Hearts. And the next time I went back to chemotherapy, I just brought hats just to give, just to lighten up the room, just to do something to give back. And it's been a beautiful, amazing journey for me. And just to fast forward, with my first diagnosis in 2018, I was re-diagnosed with stage 4 metastatic disease. And let me tell you, when I think about it, my life I thought I was done battling breast cancer. I was like, I was on my survivor road. I was doing advocacy work and great things with PCAD and Siteman. And then my world just shifted again. And I thought, God, why me? Stage 4. And I thought, like Dr. Collins, I thought my life was over, stage 4. I'm like, okay, what do I do with this? And so for me, my cancer came back, and it spread to the clavicle in my neck, my left chest wall, and the bone in my back. And for months, I had been experiencing this back pain. And so I was kind of just associating this back pain with, oh, I'm getting older. I pulled something. I was like, oh, I'm drinking too much Starbucks. Okay. I was just trying to do anything, trying to figure out, this back pain. So it would just take me totally out. I would just have to lay out for days on the couch. And I was like, but something still wasn't quite right. So I woke up one morning and I had this lump in my neck. and this lump was hurting in my neck. So I called my oncologist. I said, we're family, me and my oncologist, and that's a beautiful thing. And I said, I woke up, I have this lump in my neck and it's hurting. And she said, in your neck? And so here we go. I can't tell you all of the emotion that went along with when I had to get my biopsy in my neck. I started thinking about all of these things, all the things I went through with stage 2, because no one told me that there would be a cost associated with cancer, right? And talk about disparity. So to me, there are these 3 things that are the hidden things. There's this monetary cost of cancer, there's this physical cost, there's this mental cost, right? All these things, initially you're never really talking about that. You're just going through the treatment. And so I had this anxiety, I must admit, like, how am I going to afford treatment? What is that going to look like for me? Because I was still suffering for some of the impacts from my first diagnosis. And so I just had so much anxiety there, and like, God, what am I going to do with this? What is this? And so I'm so grateful. And Dr. Collins, you are correct. Treatment is going well for me. I'm able to maintain a certain quality of life, thank God. I am able to continue my work, my advocacy work with beautiful organizations in the community. I'm so blessed and honored, just to be able to share my experience, my voice. But no one really talked to me about the disparities that I would have to encounter. So when we're dealing with cancer, the last thing you want to think about is my insurance company going to cover my treatment? Me having to see that medication costs $11,000, or having to get scanned every 3 months, and battling with my insurance company because they might not want to cover me getting a scan, a PET scan and a CT all together. So all of these things that just rushing at me. And so becoming your own advocate when you are battling cancer is just something that I've had to grapple with. But it's been an education component for me, because I'm telling someone else, like, this is my experience, right? You don't have to say, I'm going to take the medication that your insurance company wants you to take, that fail first method, that step therapy that, I didn't know anything about until my diagnosis. And so it has just been a journey that I have had to embrace, thankfully. And I'm so grateful that I'm able to maintain and to give back, and just to participate in wonderful platforms such as this, and beautiful people in the community. And it's all about me just sharing my journey and celebrating others who are in the same situation as I am. I really like to focus on celebrating the beauty of a cancer survivor. There's still so many more things than breast cancer. So that has become my mantle. And I ask that you guys continue to lift me and those other patients up as we battle through this thing. I'm so grateful that all of the new medication, clinical trials that are out there. So I'm hopeful. I hear stories of metastatic patients 30 years, and I'm like, I only pray that that's my story. But gracefully, I feel great. And I thank you guys for allowing me to just to share a piece of my story. And I just like to always share with other patients, stay encouraged, because this is not the end.
Absolutely. Thank you so much, Dr. Robinson. That was moving and inspiring. So for another inspiring story, we're going to go and get the perspective of the caregivers' experience. Cheryl?
Well, thank you, Marilyn, and it's my pleasure to be here today. I'll try to keep this as short as I possibly can. But anyway, today, as Marilyn said, I will be speaking in regards to from a caregiver perspective. Actually, it was my mother who passed away from colon cancer in June of 2011. just out of the clear blue sky, she started being different in her everyday, activities and everything. She just wasn't herself. And everything just went so fast with the colon cancer. It was probably about 2 months of her not feeling good that we had actually discovered that uh, her colon cancer, um, was in her body and everything. But my mom, she lived with ulcerative colitis for most of her life that I can remember, growing up. And so that was always something, that she dealt with, but we really didn't, know a lot about. So as the years passed on, she ended up with a colostomy bag in which they removed a large part of her intestine. So going back as a caregiver, there was a lot of things. I was only one of the caregivers that was. I had a lot of siblings, so I was only the one of many caregivers that cared for my mom. But one of the things, once we found out that she had the colon cancer, we immediately set up hospice, just so we could have that support and, know how to deal with this and all of that. But being one of her caregivers, I noticed one day when I was going through some of the mail that bills had not been paid. And my mother, she always stayed on top of everything. And because I was on my mom's checking account, it was easy for me to just go ahead and start, taking care of the financial things that needed to be taken care of. So that really wasn't a burden. It was, to me, it was just something that had to be done. But luckily, because someone was on her checking account with her after my dad passed in 1983, I was the one that was able to take care of those things. And you really don't think about, things like that. Being a caregiver, can you, take care of somebody's finances without having to go through a whole lot of getting power of attorneys and all of that. So that wasn't a big issue with me and my family. And, you know, with her having the colostomy bag, there were other things that also needed to be taken care of, such as her, daily hygiene, because she wasn't able to do things for herself. She went from being this strong, independent woman to this woman that became very uh, helpless. That couldn't do anything for herself. And so some of the things, we had to make sure that she was getting was her daily medication, that she was eating as best as she could, uh, drinking fluids, and like I said, her daily hygiene, and definitely taking care of her colostomy bag because that was a big issue. My mom had always taken care of that herself, and she was a very private woman and did not want anybody even seeing her bag, not alone taking care of it. But once she became not able to do all of this, then, we had to step in and learn how to do those things for her. So not only did my mom, and I was one, like I said, of many caregivers. Luckily for me, I had siblings. Some of them lived out of state and they came in and spent weeks at a time here, so they could help, assist us. So not just one person would, um, I'm not going to say the burden because it wasn't a burden, but not just one person, step in to take care of her, but I had the help of all my siblings and some other family members. That was my mom's sister and one of her brothers. So my grandmother also, my maternal grandmother, also passed away from colon cancer. Her and my mother was probably about a year apart in age, as far as when they passed away from colon cancer. What I do want to say today, it affects everybody differently, dealing with the ulcerative colitis. It can be moderate, it can be severe, it can be very severe. I think my mom was more on the very severe side because, like I said, she always had issues, um, with just dealing with that. But the one thing that I do want to say today is that it's very important to know your family history, because without that family history can make a difference in your life, in your children's life. And always knowledge is power. I live with Crohn's disease myself, but mine is very well managed. I haven't had a major problem probably in the last 12 years, no, last 15 years. So I'm very thankful for that. But so after my mom passed from the colon cancer, back, yeah, I want to say in 2012, it was just something that, I felt like I should do to honor her name. And so I thought about, okay, maybe I can have some type of fundraiser activity. And most people that know me know that, exercise, me going to the gym is something I do daily, just like waking up. I go to the gym every day. And so I came up with this idea that I could do a fundraiser event to honor my mom, who I felt like she deserved to be honored because of the suffering and everything that she had gone through with dealing with this colon cancer. And I wanted to bring awareness to other individuals, that sometimes people don't like talking about colon cancer and having Crohn's disease and ulcerative colitis and all of that, but it is definitely something that needs to be talked about. I myself personally didn't like to talk about my disease, but now I'm really more open about it, because it's important that people know that you're not the only one that's out there that might be suffering, from something like this. But so I came up with the fundraiser idea, and I invited PCAD, and that's how I became involved with PCAD. And so for 8 years, I did a fundraiser event in my mom's name, and I did it in her birthday month, which was September. And the money that was raised went to Colon Cancer Alliance and food outreach because my mom liked to cook. So I said, well, why not just, give funding to a deserving um, a deserving non-for-profit organization that uh, help people that has cancer, HIV, AIDS, and I forgot the other thing. That's a shame. But anyway, so that's what I did for 8 years. I raised funds in my mom name, and I gave the money to those two different organizations. And so that's how I became a community member for PCAD. So thank you, Marilyn.
Thank you, Cheryl, and we certainly love you on our community partnership. Uh, Cheryl serves on our colorectal cancer community partnership and has been ever since, and give great insight for our programs going forward, for awareness and prevention in the community. Thank you so much, Dr. Nicole Robinson and Cheryl Gee. We're going to open the floor for questions now. So I see no questions in our chat thus far, but I'm going to start off with a question. So knowing that we're in the pandemic, have been in a pandemic for close to 2 years right now, Lord have mercy. But I wanted to address the question on screening. We do know before COVID that there was a concern with late stage diagnosis of breast cancer, specifically in certain zip codes. So we want to pretty much know what is the screening rates now. I know across the board in some areas that screening has gone down. So Dr. Glover-Collins, will you want to address that?
Yes, I actually don't have any numbers on what the screening rates are, but in particular, the major reason is that initially when COVID started, the institutions actually stopped screening because they wanted to decrease the number of people that were coming into the building at a time to try to decrease the spread. But screening has gotten back up and going, and I think the major thing that we want to stress is that screening is available. You don't have to have a doctor to order it. You can go and get it done. And that is that it should be done, if not every year, you should do it every 2 years so that we can catch the problems. Because screening doesn't prevent the cancer, it helps us to catch it early. And as we have said time and time again, early detection leads to the greatest cure rate. So um, I think we just have to get out that it's safe. It's safe to come and get your screening, and we need to do it.
Thank you, Dr. Glover-Collins. Dr. Norfleet, with you being internal medicine physician, I know you talk to your patients quite a bit about keeping up with their screenings, especially if it's at that point where they're at the age to do it. I have to admit myself, I was a little bit late going to get a mammogram, but I get it every year now. So I know some people are still kind of hesitant to go get a screening. So what is your approach when you talk to your patients?
Well, you're absolutely right, Marilyn. What I have found during the pandemic, and as we're continuing to go through it, we are very behind on screening. Patients that are now coming into the office usually do not have their mammogram. And unfortunately, we don't have the ability to get same-day mammograms like we used to, because previously I would tell them, go upstairs and get your mammogram now. I can't do that anymore. So patients have to actually call to schedule to get their mammograms, which may delay screening even further. For my patients, I've been practicing for 19 years, so my patients know me. They know that they must get their screening test done, or they must have a very good reason why they have not gotten it done. In fact, most of my patients tell on themselves when I walk into the room to tell me, Dr. Norfleet, I didn't get my mammogram done. I'm like, oh, okay, glad you told me. But my goal is really just to convince patients that it's important to get the screening done. We're trying to detect, as Dr. Glover-Collins said, detect disease before it's actually recognizable, and hopefully we can treat it, remove it, and that it's curable. There's a decreased rate of screening in African Americans. So I think it's important, as being an African American physician woman, to encourage patients in my community that it is okay and they should get it done. So I guess to answer your question, what do? I just be myself, and I let patients know, don't come to me without your screening test, because I care about you. And if I care about you, you should care about yourself.
Can I also interject that I think one of the major reasons why some people don't get it is like, oh, it hurts, you're going to smash my breast and all that. And I tell patients, before, when I first started, I had never had a mammogram, and that's telling off on myself that now I have had mammograms. So I say, the screening tech told me that if it hurts, that maybe we're doing something wrong, but they won't know that it hurts until you tell them. So, and then I also tell my patients that it's all about a few seconds of discomfort versus a lifetime of battling something that you don't have to. You have to always put it in perspective and just get them past that initial point of fear and get them there, I think.
Yeah, and it's important to identify with the patient. When my patient tells me it will hurt them, I tell them you're absolutely right. It does. But I go and get it done. It's just a couple of seconds. It's less painful than surgery. So let's get our mammogram done.
Marilyn, I have a question.
Mhm. Sure.
You mentioned targeting certain zip codes. Is North County still one of those, I'm going to say, hot pocket areas where the number of late stage is really, really high? How's that looking for North County still?
I was to say, absolutely. We are striving to get more women in the North County area. We actually just started or launched our program, the Healthy Women. It's not called Healthy Women.
Show me healthy
Show
women.
Me Healthy
Yes.
Women. We actually just got our funding back at Christian this past year. And our goal is to get people the screening for cervical cancer and breast cancer, and let them know that it can be at no cost, but you have to show up. And so I think Dr. Robinson put it beautifully, there are those hidden things like the costs and finances associated with it. And we don't want your worry about how am I going to pay for this to be one of those things. So there are lots of resources beyond Show Me Healthy Women to help you get a lot of these things for a lot of these services for free. We just have to get you connected, but we can't connect you if we don't know about you.
Absolutely. So, excuse me, there is a question in the chat. And Dr. Tepe, thank you so much, because this was the question I was going to ask. She wants you to talk briefly about the screening for individual with dense breasts. Is that still a mammogram or a different type of screening?
So mammogram is still the gold standard. And we have to thank Dr. Lannis Hall and our legislators, because initially the only type of mammogram that you would get offered would be a 2D screening mammogram. And then if you wanted to pay an additional cost, then you could do the 3D. And some insurances covered it, some did not. But since that legislation has been passed, 3D mammograms are offered universally to women. And that is mainly the type of mammogram that a person with dense breast tissue should have. And it just helps us to see smaller things better in dense breast tissue.
So the great thing about it now across the board in the Siteman sites in the Breast Health Center, they offer all 3D now, which is really good. There was a time where you didn't have that option because insurance would not cover the 3D. But now they cover the 3D, which is excellent, as Dr. Glover-Collins mentioned about the difference for dense breasts. So I want to pose this question to one of our survivor, Dr. Nicole Robinson. I know you and I have done quite a bit together on projects and work. We did an advocacy video for Susan G. Komen, which went nationwide, but it was particularly about access to care. So if you want to talk a little bit about your trials with step therapy, if you don't mind.
Yeah, I had no idea it was actually called step therapy until our collaboration that we did with Susan G. Komen. I just knew that I was battling the insurance company when I got re-diagnosed, and I needed to have treatment. My doctor, my oncologist selected a certain treatment for me. And so my insurance company right off the top denied the treatment that was recommended. So I was like really, really livid, because I thought, like, how dare an insurance company have the right to dictate my treatment when they don't even know my history? And I just thought how disingenuous that is, right? And so it led me to start like this online petition, because I kept submitting appeals to try to get the treatment, and the insurance company kept denying. My oncologist and we submitted, papers to show why we thought I would have this treatment, but they kept denying. So becoming your own advocate, I started this online petition. It was called My Treatment, My Choice, where I pretty much went to social media, and social media can be really powerful. I pretty much said the insurance company was denying me treatment. I even went to my representative to even seek help. Sometimes we don't know that we could utilize that, that out there as well. So I was like, my insurance company isn't approving my treatment. So it was like delaying the start of my treatment. I started some other medications, but this particular one that was for my bone, they were just denying it. And so had no idea. I thought, how could they want me to take another drug that was at a better cost for them, right? And them not having to cover it. But I thought they didn't know how I would react to the drug, or what kind of adverse reaction or if anything. Even some of the studies that we presented showed, some of the issues that the drug they wanted me to take, but they were still, they wouldn't approve it. So like I said, social media can be a powerful thing. I went to social media and tagged the insurance company. And I tell you, people started just, putting in feedback like, wow, how can they do that? How can they? And it happens not only just in cancer and so many other chronic diseases, right? And so, when they saw that, when I tagged the insurance company, immediately they said, call us. Okay. Can you call us offline? And then I got a little power. I was like, oh no, I'm going to tell you. So, and that's really how it started, but not until my work with Marilyn and PCAD and Susan G. Komen. I didn't know it was called step therapy. I just knew I was in the midst of this battle with my insurance company. They want the fail first method. And I just thought how fortunate I am to have certain insurance, but sometimes we don't know we can advocate for ourselves and even appeal a decision. So we just, as patients, we just accept what the insurance company says. Well, take this drug. And then, that could be something that could be detrimental to our lives. So, but all of the amazing bringing that to light and me learning about step therapy, it's really, it's happening all the time, and it continues to happen. And, it's been great working with Susan G. Komen, because they're continuing to work, with legislators trying to, different legislation to help that, but it still happens. And I still battle even today with that.
Access to care is such a huge thing. It is such a huge thing. And I think we are pretty blessed to have, organizations that advocate, as well as individuals like Dr. Robinson and some of you out there that advocate. So we encourage you more and more. And I'm just so grateful that I've been involved with Susan G. Komen as well to do that advocacy piece. So if anybody have any questions, it seems like I'm taking over the questions. Please, you can submit your questions in the chat, or you can, at least you can come off mute or use emoji to say, hey, I have a question. Cheryl, I wanted to ask you a question as well, since I'm waiting on other questions. Being a caregiver, I pretty much know how that is. It's hard, whether it's cancer or whether it is any other chronic disease. So how did you pretty much do self-care? How did you take care of yourself during that time?
Well, I went to the gym every day, as I said. That's, people sometimes seem to think that's just for your physical, but no, it is definitely for your mental state of mind, as well as your physical state of mind. And so that just helped me, to take myself, take my mind off of things, and do a workout and just come back and just rejuvenate myself. So that was my therapy for me, going to the gym every day,
Definitely.
putting myself first.
Yeah.
Sometimes caregivers don't put themselves first, and I think that's where a lot of times people have problems, is that they're trying to do everything, but then they're forgetting about their own health and their well-being, and just not taking care of themselves. But you have to, in order to help somebody else, I always believe you have to take care of yourself first.
One of the things that touched me in your presentation, Cheryl, was that you said when you knew that your mom had cancer, you got hospice involved immediately. And I think, that's something that we should highlight is that hospice doesn't mean that that you're dying right now. And people don't often take advantage of the services that hospice can provide in terms of support and helping you through this time. And one of the things that I'll remember as a medical student is that the hospice director was like, people usually only come here when they only have like 2 weeks to live, but there's a lot that they can provide. And I think we should do a better job as informing people of that.
Yeah, I think we had hospice for about 3.5 months before my mom passed.
Yeah,
Dr.
that's a conversation that I have with my patients many times because you're right. Like their perception of hospice is you're going to die. And many times hospice is so valuable for the support of the family. We forget about care for the caregivers. And I'm so happy, Cheryl, that you took your care and made it a priority. Like when you get on a plane, they said before you put the mask on the child, put the mask on yourself. Make sure that you are taken care of, and you did that. There are some programs out there that do offer care for caregivers and emphasize that. But I want to applaud you for taking care of yourself. And then if I can jump in, I do want to applaud you, Dr. Robinson, for being an advocate for yourself. That is very huge. And believe it or not, we doctors fight insurance companies every day trying to get the best medication for our patients. So I certainly applaud you and what you have done. That is amazing. And it's unfortunate that we have to go to social media to quote unquote embarrass someone to make them, take better care for ourselves. But it is important, as you said, to advocate for yourself. And that's what I would say to anyone on this program. If you don't agree with your treatment, you and your physician continue to advocate for yourself. No doesn't necessarily mean a continued no, but you don't know unless you continue pushing for yourself.
Yeah, and again, if I also could speak to that piece about hospice, and you're right. I think it's sometimes within our own community, the African American community, maybe there's this fear, and I have to admit it, even with myself, being diagnosed with stage 4. I guess there's just this fear. So more education is needed because my father, he passed of colon cancer. Have friends, colon cancer, liver cancer. And then not until you're at the very end, then that's when they think it's available. So I think there is more education needed and provided to us so we can have that comfort level and not to say, this is your end, because we usually think that's what it is, right? So yeah, if I could have more information, provided to our community in particular, it would be great.
All right, I have one question, one point, since we're going to be transitioning into our break. We use our 8 ways to prevent cancer educational materials, brochures, in our outreach initiatives all the time. But one thing we have not talked about, which is a very important piece for our health across the board, whether to prevent cancer or whatever, is nutrition. If you can kind of jump in and give us some guidance of what is it that we need to do to keep our colons healthy, to just keep our general body healthy. Anybody can jump in, Dr. Glover-Collins, Dr. Norfleet.
Sure. The first thing would be, what's healthy and what's not healthy. It's not hard. So the emphasis would be, of course, fruits and vegetables, right? Anything that's natural or plant-based is better for your body. Plenty of water, a lot of fiber, which once again goes back to your fruit and vegetables. Personally, I feel that we need to decrease our consumption of meats. And yes, that includes chicken. That is meat. So I think we should, go more towards seafood, fish, and a plant-based diet. You have to remember that all the food that you put in your body has to travel through your colon, and it sits there for a while. But it's easier to transit when you have high fiber, high fruits and vegetables, and a lot of water. So if you look at your plate and you say, oh, that's probably not healthy, it probably isn't.
I want to echo that part about the water, and it's water. It's not Coke. It's not Gatorade. It's water, because that's what helps to make them come out, your stools come out better and softer. So you eat all that fiber. If you don't take in the water, it's not going to be a good day.
That's, well, one thing I did have to specify, if you can clear that a little bit, Dr. Norfleet. You say plant-based diet. Some people get a little confused what plant-based diet specifically is, because you have a lot of products out here in the grocery store that says plant-based. Whether that is natural, making things from scratch, your vegetables, could you explain that a little bit?
Absolutely. I'm glad you asked that question. I think the key is that you said a lot of products are plant-based. So if it's a product, it's probably not plant-based. When we're talking about plant-based, we're talking about those things that come out of the ground naturally, that our bodies naturally can process and absorb, and it can flow through your system. There are products that are plant-based, and my recommendation is if you eat those sparingly. They are not the best for you, such as fruits and vegetables, but it is an alternative to unhealthier foods when you compare them. But do not go to the store and buy every quote unquote product that is plant-based and think you are following a plant-based diet.
Did you just ruin my day? Because I don't eat chicken, I don't eat pork, I don't eat beef, but I do eat some of those plant-based products.
Yeah, and we all do. I would be remiss if I would say that I didn't go to, I'm not going to name any companies, but get a meal with a plant-based sandwich in them. But I do make sure that I don't do that regularly. It's usually a treat, or if I'm traveling, I will do that, but not on a regular basis.
Moderation, that's the key.
That's the
Moderation.
key.
All right, do we have any more questions? This has been a wonderful dialogue. Wonderful, wonderful, wonderful. We have time for one more question.
Marilyn,
Yes,
if you
ma'am.
will allow me, I'm not sure in my presentation if I recommended, screening guidelines and when to repeat certain testing. So I just wanted to generally state that if your colonoscopy is completely normal, and there's no family history or increased risk, then generally it will be recommended to repeat your colonoscopy in 10 years. If a polyp is found, that we will determine what type of polyp it is and then give you further recommendations. But for patients like our people like Ms. Cheryl, if there is a family history of colon cancer, recommendations are to actually start screening at the age of 40. And then usually every 5 years, if your family member was diagnosed when they were less than the age of 60. As Cheryl mentioned, her mother had ulcerative colitis, and I believe, if I'm correct, she had Crohn's. Those are inflammatory bowel diseases, and those increase your risk of colon cancer, and usually you need to screen earlier. So that's why it is important to let your physician know your family history. Because if you tell me those things, then I can tell you what the next steps are.
That was wonderful information. Thank you for giving that as well, because some of us struggle with that. If you wanted to talk about, we have a couple of minutes, the prep, because there is some conversations about the prep. People usually don't like doing it, and me being at that age to get colonoscopies on a regular basis, that for me personally is the worst part of the whole thing.
Yes, yes, and that's certainly understandable. So for those who don't know, the prep is not pleasant at all. You usually have to drink a lot of fluid because the idea behind it is to clear out your colon. We have to get all of that stool, all of those foods that are not plant-based to go through your colon so that we can visualize it. And that's why it's important for you to complete the prep, because what may happen is if you drink half of it, then your doctor cannot visualize your colon. And guess what? They're going to say, come back in 3 months. So that's not fun. But you're absolutely right. The prep is not a great experience in any way, shape, or form. But I can say that we can get through it. One recommendation that I do give patients is prior to your prep, don't go and eat everything under the sun because you feel like you can't eat for one day, because what you are doing is making your prep harder. You have put food at the beginning of your colon, and now it has to go through your entire colon for you to clear it out. So it's better to do like broth-based foods, clear foods, things like that, because when you do your prep, the goal is to, when things come out, that it's clear. So if you eat those foods prior to, then it's less likely that you have to drink all of the liquid to complete your prep, because the instructions are usually keep going until what comes out is clear. You will find that I joke around a lot, but I can say that if we drink alcohol, if we drink those other things, we can tolerate a prep just once, especially if you have to do it every 10 years. We can do it. So I haven't had the opportunity to have a prep yet, and I probably will state more after that, but I still encourage us to just go through that test. We're trying to remove disease from your colon so that you never have to experience it.
I can say, as a person who actually have done colonoscopies on people, we used to have people that didn't want to do the Go Lightly prep that Dr. Norfleet is alluding to. And if you want to make it easier for the 2 days before your prep, go on that liquid-based diet, because that will make it much, much easier.
Can I also add on that is that make sure when you take your prep, as Dr. Norfleet says, she likes to joke around, but make sure that when you take your prep that you are at home. Please,
Yes.
at home.
Yes, something to consider to avoid decreasing more days of work is to try to get your colonoscopy scheduled on a Monday. That way you can prep on Sunday while you're home and don't have to take maybe 2 days off to get your testing done.